Good afternoon, everybody. Thank you, everyone, for joining us for the next webinar in our Lymphedema Awareness Month series. My name is Cheryl White. I'm a physiotherapist and clinical advisor for the North of England for Haddenham Healthcare and former BLS editor. And I'm joined today by Carla Zanichelli, lymphedema specialist, physiotherapist, and lymphedema service lead at University College London Hospitals NHS Trust. We're glad that you're able to join us today. And during the main presentation, there'll be a live Q&A with the speaker, with both Carla and myself. So during the webinar, if you have any questions, please pop them in the chat and we'll aim to answer them later. So now, further ado, we'll hear from Carla, who's talking about activity and movement, the hidden lymphatic gem.
Hello everyone, thanks a lot for joining us today with this session. Now we will talk about movement and activity or exercise, call it like you want. It doesn't matter, it's about movement and how it affects the lymphatics. So Cheryl White and myself will actually do this session. Cheryl is a specialist lymphedema physiotherapist and a BLS editor, and I am as well a lymphedema specialist physio, and I'm the lead of the lymphedema service at UCLH. So with this talk or this session, what I would like for you to learn is just two things. One is why it's important to move when you are at risk or you have lymphedema, and the other one is that allowing everyone to treat lymphedema. So allow yourself to be confident enough, even if you're not a specialist, to start treating lymphedema, because it's actually a tool that we have to treat with activity and positioning. So these are the main things that I would like you to learn. But for you to learn this, I need to explain a bit of anatomy first. So the lymphatic system is like a tree root, only one way, starts underneath the skin and then it goes deeper, forming bigger vessels. So from the legs, it will drain from toes, it will go all the way up the leg, all the way up the body, and will finish at the base of the neck. For the arms, it will go from fingers all the way up, going through the armpit and finishing at the base of the neck as well. Head and neck is the opposite, so it will go down and as well will finish at the base of the neck. At the base of the neck, the lymphatic vessel will actually join a vein. So all this fluid that the lymphedema system will carry will end up in the venous system. So we have all this fluid in our tissues that we actually generate or produce every day as a normal thing, needs to enter the lymphatic system and needs to enter the first lymphatic. So it's one way, tree root. So the first lymphatic is like a finger and has little doors, and the fluid around it will actually enter these initial lymphatic by these doors. So the lymphatic system is made by chambers, and every chamber is separated by a valve. So this first lymphatic is the first chamber. When actually we have all the fluid in, the pressure of the fluid will make little muscles on the wall of the vessel to contract. The valve in between the chambers will open and all the fluid will go into the next chamber. And in the next chamber will happen the same. When it's full, the pressure of the fluid will make the little muscle on the wall of the vessel to contract and go to the next one. So when we have the first lymphatic full, then it will actually have a peristaltic movement and it will actually go the flow to the base of the neck, really. The lymphatic system doesn't have a major pump, has these little muscles on the wall of the vessel, and what it helps as well to drain, it's the muscle pump. So when we do exercise, when we move, when we do activity, doesn't matter how you call it, when the muscle contracts, we'll squeeze the lymphoedema vessel and will promote this actually flow as well. So the contraction of the muscle will mimic that peristaltic movement that we did talk about, that the chambers do when they actually get full. So the lymphatic system not only is responsible to drain all the fluid that we generate every day, is responsible as well of our immunity. So very important to actually have the system working. So these lymph facts you'll find in the BLS website are very helpful. So please go and check. So the movement will help the fluid that we have in the interstitial fluid to go into the first lymphatic, and then activity as well will actually help this transport of the flow because of the muscle pump. Because all this fluid that we actually generate in the tissue has a lot of products, because it's what the cells don't need. So it will actually have waste, or oils, proteins, fluid, all this. If we make sure that this doesn't stay in the tissue for long, we will have healthier interstitial fluid. So these actually will actually as well get better tissue healing if we have a wound. And it as well reduces inflammation, because it actually, all the toxins that are in this interstitial fluid will actually be drained and not staying in the tissue for longer than needs to be there. The muscle pump is more effective if we move the joint. So it's very important that our range of movement, or the range of movement of our patients, is actually as good as possible. And the muscle pump not only will help the lymphatic flow, will help as well the venous flow. Now, when someone has already lymphedema and has been prescribed by a specialist with a compression sleeve or a compression stocking, it's better that they do the exercises meanwhile wearing it, because it will actually improve the muscle pump. It will be even more effective, the drainage. We actually use the diaphragm as well to actually create different pressures between the abdomen and the thorax and the thoracic area to actually drain the thoracic duct. The thoracic duct is a vessel that we have in crossing all the body, from the lower body goes up to the neck, and it crosses the diaphragm. So when we do deep abdominal breathing, what we do is actually use the diaphragm, and we will actually increase and decrease the pressure on the abdominal area and the thoracic area. So we will actually do again a pumping effect, getting all this actually vessel to get better flow and help the drainage. We always recommend to start small and build up gradually, because if you overdo, the muscles can actually create more fluid, and this will go into the tissue and we'll need to drain it. So it's better to actually gradually build up the exercises or the activity that we are actually wanting our patients to do. Something is better than nothing, always. So even if it's small walk or a bit of exercises at home, encourage everyone to move, even if it's little. Good posture and flexibility. It will be important to avoid joint restriction, so we'll have more muscle pump. So activity should be easy, because otherwise people won't engage. It's difficult. It's going to be actually very kind of tricky to do it every day or regularly, and it needs to be achievable. So we all live busy lives. We cannot actually ask someone to do 5 times a day exercises, because it will actually last a week, a month, but then it's going to be very difficult to actually keep going with this. Now it needs to be safe. We don't want to put more actually problems on top of what we have already, and it needs to be pain-free. So we are encouraging here to have muscle pump, not to work on a joint problem. We don't want to actually increase the range of movement with these exercises, but promote the muscle pump. If someone has a problem with the range of movement, we need to actually refer them to physio. It will actually be easier if the patient incorporate the exercises or the activity as part of the daily activities. So some people find it easier if they do the exercises when they brush their teeth, or to actually go out and walk first thing in the morning, or to commute to work. So if we actually link it to something that we are already doing, it's easier then to keep going and doing an activity. And if it's fun, then we'll have even more engagement. Now, you can exercise a lot, but then if you actually have a position that actually refills your limb, then it's not going to be very useful. So we need to actually take gravity off the limb to be actually having all these benefits from the exercise and not to refill it. Now, for the lower limbs, as we said before, the drainage goes from toes all the way up to the neck, so against gravity. So we need to actually try not to be on our feet for long periods of time or sitting down with the legs dependent. So when they sit down, they should actually have the feet up. The ideal position in sitting down will be actually the recliner chair. Yeah. So for standing up, we will say just actually get your weight one foot to the other, march on the spot, try to actually go to the toilet if you are at work, or to break it and try to move. And it is actually really important that they go to bed at night, because this way we have a lot of hours without gravity and helping to actually the drainage to keep up. Now for arms is the same. So when we are up and about, gravities will affect as well the drainage, because it goes from fingers up to the neck. So if we want to take gravity off that limb, what we need to do is put it in hard level with cushions under it, and that's it really. We don't recommend slings because they won't encourage drainage, and they'll actually encourage a position where the elbow will be flexed and probably will actually gather then swelling in the elbow. For palliative patients that struggle with the heaviness of the arm, sometimes it's difficult to walk, so then yes, the sling will be actually something to consider, but just for those periods where it's difficult to manage, and as soon as possible take it off, and if needed then yes, so we rest it on pillows and ask them to actually open and close the fist, because this way we don't have gravity and we have the muscle pump helping with the drainage. For head and neck, a lot of you, maybe you don't actually see them. Head and neck swelling normally is because of cancer treatment, but if happens that you actually have someone that is in your caseload, then the recommendation will be to sleep with an inclined position. So the drainage with the head and neck, it will be going down. So when we are up and about, gravity helps the drainage, but when we are lying down in bed, so not so much. So we ask them to have pillows, but not one on top of the other, but a bit doing this inclined position to actually help better the drainage during the night. One thing that it's actually impacting a lot on head and neck lymphedema is looking at the mobile phone or any device for long periods of time, or even reading a book, because then they actually have their head forward and it makes build up of this region. So what we will ask is that they put a book or the mobile phone or the Kindle on a surface that it keeps the device in an eye level, and this way the posture is actually fine for the drainage, and they can actually do the same thing with the device. There are a lot of exercises out there. What you need to bear in mind that you need to move, or you need to promote the patient to move the area where the swelling is or where is at risk of. And there are lots of resources in the British Lymphology Society website, in the Everybody Can campaign. I put all the links there for you to explore. In Cancer Research UK as well, there is actually lymphedema exercises that are very safe for everyone, and they are very basic, but it's an idea for if patients don't have anything that they want to follow, like a sport, or and sometimes they feel a bit lost on what to do. So these ones are good ones, but these are not necessarily the only one. So the CSP, the Chartered Society of Physiotherapy, had a campaign called Stronger My Way, and is actually as well doing exercises working on the strength. That is very important as well. And the Royal Osteoporosis Society has a program called Better Bone Health for Everybody and incorporates balance. So it's finding those exercises that are more beneficial for your patient. The government, Health England, a lot of people are looking at the importance of exercises. The problem is that sometimes exercises seem very tedious or difficult. So talking about activity and movement is actually a good way as well to engage people. And the World Health Organization tells you very clear, every move counts. So they are quite a visual prompts, and they only tell you, please don't have a sedentary lifestyle. So limit the time that you don't move, basically, and do whatever you like. And this is what we need to understand. It's not about exercises, it's about moving. People sometimes like to dance. Some people actually like to walk. So let's try to actually be facilitating all these resources for everyone to move more. To sum up, so for me today is like, please start treating lymphedema or chronic edema with activity and positioning. It's very important to move. So now I will actually wait for your questions, and hopefully I'll be able to give you some tips or whatever it actually you feel that you want us to answer. So thanks a lot for listening.
Thanks, Carla. That's a great webinar and lots of really useful information. We've got some questions that have come in already, and if there's anybody else that has any questions, just pop them in the chat for us. But I thought that we would be asked about what exercises would we discourage for, say, for an affected arm or affected limb. Basically, anything goes. I think you'll agree, Carla. The main point that I would say is that if you're beginning exercise, or if you've had some surgery or some treatment of some sort, or you've got an affected limb and you're starting exercise, if you've already done exercise previously, I would say just to start the exercise as if you've never done it before. So build up gradually, build up to the things that you were doing before. But do you agree, Carla?
Yes, I do. I think I've only said no once to exercise, and it was not really a strong no. It was someone that did practice taekwondo, and I didn't want any bruise there, so I said to actually not to have the impact. But for the exercise itself, yes. But then there was actually a risk of broken bone or a bruise. So was like, I think the only no that I said, no impact, but yes, continue the exercise. So if it's a risk of falling or having a bruise, then we need to actually kind of be careful, because you don't want more swelling, because this will create more swelling on top of it. Mm-hmm. But I think it's the only one that I said no to.
So things like weight and resistance training, we would have no problem with that, as long as it's built up gradually.
This phone was
exactly.
Okay, so there's another question about can we build muscle if we have lymphedema?
Yes, please. Yes, it's always actually, as Cheryl said, so know your body. So it's better not to overdo. So just to start with, and then try to actually, if you're used to actually weight, then just do what you are used to, and then try to see if a bit of more weight or more repetitions are okay with your body. And perfect if it's your body actually is not more swollen, or it's not telling you maybe this was too much, increase progressively. It's only that. So we always say that you need to actually start with what you are used to, I work with mainly cancer patients. So with my patients, they've gone through cancer. So when you go through treatment like this, you are weaker because you've not been moving. So if someone is used to do something before cancer treatment, then we always say, let's try a bit less, because probably you've lost muscle tone and you need to build it up. So that's why we actually say, let's do a little bit less. So everyone is different. So if you are used to actually walk, or if you are used to actually go to the gym, you know exactly what you've been doing. So just increase the repetitions or the weight a bit and see how you actually feel about it. If you have a bit of swelling or achy, maybe you need to slow it down a bit, do more rests, or not so much weight. But this is the only thing. So yes. And nowadays we know how important it is to do strength exercises, because when we grow older, we lose muscle tone. So all of us should be actually doing strength things with weight, and or even with resistance. Our body sometimes is enough. You don't really need to do weight sometimes. So it's actually kind of having this kind of working a bit more to challenge our bodies to keep these muscles going, because they are very important for keep our health.
So a mixture of weights and cardiovascular exercise is the ideal, really. If you're able to do both, that would be sort of the recommendation, I would say. And we've also got a question about, is it beneficial to do exercise in water? Now, I'm a real advocate for going swimming, or doing aquafit, exercise in water classes, especially if you've got a heavy limb, because the weight of the buoyancy will help the weight of the limb and make your limbs feel a lot lighter. And also you've got the resistance of the water, which helps to give resistance-based exercises, but in a water environment. So yeah, really, really helpful to do exercise in water. I think it's a real shame that in this country we don't have more facilities to do health-based exercise in water. In Australia, for example, they do a lot of aquafit and so on for lymphedema and lipedema patients. But yeah, that is something certainly I would recommend. You?
So some people, when you mention exercises in water, they tell you, oh, well, I don't like swimming. So you don't really need to swim. So if you have actually swelling on the legs, it's more beneficial to walk, because you have more pressure standing up on water. So just walking inside the pool is actually really good. Or even actually with the arms, you can actually push the water, and these will create resistance. So all the aquarobics help a lot. So it's not about swimming. It's actually going into the water, feeling lighter. You don't have so much weight. You don't have gravity. And then you have actually the pressure of the water as well helping. So it's a very nice exercise if you have a pool nearby, or some sort of, I mean, I like the sea as well. There is a lot of our patients that try to swim in the sea, and they say, it's even actually more helpful than the swimming pool. We don't know why. I don't know why. But it seems that the sea helps people even more. So yeah, water perfect.
I mean, I think we've also got some questions about progression of exercise, and also about things that are happening to the bodies, really, when people are, say, going out for walks. I would say that if you are finding that your limb is swelling after doing some kind of activity, or it's aching, I mean, we'll always get some aching, especially if you're starting an exercise or an activity that you haven't perhaps done before or not done for a long time. But if it's repeatedly swelling up too much after you've done an activity, I would I would suggest that you sort of just scale back that exercise slightly. Maybe you're doing a little bit too much. And also make sure that you're wearing your garments. If you have compression garments, make sure you're wearing them while you're doing any activity, especially things like walking or anything in the gym, or any kind of activity, really. Make sure that you're wearing your garments, because they will help treat your lymphedema more effectively while you're doing the activity. We've also let me just have a look at what other questions we've got. Are some exercises superior to others for improving lymphedema? I think we've answered that. I think a mixture of strength exercises and cardiovascular exercises would be the ideal. And also, I'd just like to talk a little bit about the resources that you mentioned. We've got some great resources. For example, you mentioned the Everybody Can campaign, which was a campaign the British Lymphology Society did a few years ago. And there's lots of really useful exercises and tips about activity on the British Lymphology Society website. There's a patient section and there's a professional section. So there's slightly different advice in both of those, but they're really useful to have a look at. And the emphasis on that campaign was really just keeping active. Everybody can become active. And no matter how little your activity is, it will help benefit your lymphedema. So even when you're, say, boiling the kettle, do a few knee bends, do a little, some exercises, moving step one side to the other, moving your ankles up and down. When you're putting the washing on or putting the washing out on the line, make sure you're moving, stretching up with your arms. So any activity will help improve the lymphatic drainage, and that will help improve your lymphedema. Also, the resource Live Well NHS resource gives lots and lots of benefits of exercise and useful information. And there's videos on that website, videos with seated exercises, exercises to improve flexibility. There's some Pilates and yoga. So that's a really, really good resource. Any kind of exercise or activity that you're thinking about, I'm sure you'll find it on that website. So just make a note of that one. We've got a question here. Do we have any additional advice for people who have, let me just see, sorry, who have additional advice for people who have pressure garments, utilize lymphatic machines to improve movement and function of upper limbs and manage symptoms? So what's your view on machines, Carla, to help movement?
So I think we are talking about different things. So when you actually treat lymphedema, you use different tools. So exercises is one. The machines will be more the drainage. So it's like what we would do with manual lymphatic drainage, but you do it with a pump machine. So it's different ways of draining this fluid. So pumps and MLD, yes, but we are talking about exercise. So exercise, you need to move. So to use the pump of the muscle, you need to move. So if you're using a machine, it's another pump, external pump. What I need to actually, about these actually, when you have compression garments and you do exercise, if you feel that when you do exercise, the garment is not enough, maybe you need to speak with your specialist, because maybe you need a bit stronger material or more compression, because maybe, you are not having the right garment to do exercise. So the patient needs to go back to the specialist and discuss this with them. We are all very unique. So we need to have this conversation with the specialist if you have things like this, because they know you better. It's a bit difficult to say one thing that fits all. But yeah, so I would say that I have patients that have actually they need more compression when they do exercise. So it's not that they cannot exercise, it's that they need a bit more, and then it's fine. So I would say, yes, if this is the case, they need to speak with their specialist.
And I also think it's important if you've either not been to a gym before or not been to a gym, you want to go and do that kind of activity and exercise, make sure you have an assessment before you go to the gym with the instructors there, and they will be able to tailor a program specifically to your needs. It's very difficult for us to advise here on specific cases, but if you go to a gym, that normally a gym, you have an orientation session, and they will ask you what your aims are and what you want to work on. So, and they should be able to adapt according to the restrictions that you may have with your lymphedema.
Can I mention something about the prophylactic measure of wearing compression on
Yes.
the first year after cancer? There is no evidence of this. We are not recommending this. What we really need to focus on the first 2 years after cancer treatment is that you don't develop lymphedema. So you cannot prevent it wearing compression. If you have heaviness, if you have swelling, yes, then yes. But if you don't have anything, your lymphatics are working fine. They are not different than mine. So, and it doesn't help to prevent. There are actually studies revealing that. But it's actually very important that if you're at risk, you know who is your local service and get seen and discuss all this. But if you don't have lymphedema, it won't help to wear compression for lymphedema. Yeah.
We've actually got a question about rebound and jumping exercises, thinking about helping it shunt the lymph along the lymphatic system. And interesting, we had the same question at last week's webinar, and also we've covered this exact topic in our newsletter News and Views recently. And there's very, very little research about rebound therapy and lymphedema. When we looked at this as a society, that we only came across 2 actual articles. One was a very small study, a low quality study that actually supported its use. But there was another study that focused on those that are overweight, but don't necessarily have lymphedema. But it really appears that this is an under-researched area for lymphedema, and initial views from the society were that the principles of exercise are applied, and that compression hosiery is advised, obviously, as we've said, during exercise if it's tolerated. So the general benefits of activity and exercise with normal caution really would be the advice if you go to a rebound class. My daughter actually teaches rebound therapy and does rebound exercise classes. And actually, again, similar to the answer I gave about the gym, I would advise that you speak to the instructor first. You tell the instructor your limitations, or that you have lymphedema in your arm or you have lymphedema in your leg, and they will be able to adapt the exercises accordingly. Don't be embarrassed. Speak to the instructors wherever you go. That's their job. Their job is to adapt whatever they're teaching to account for the people that they have in their class. So do you have anything to add, Carla, about that? And vibration plates as well. Vibration plates always come up. And again, there's no real evidence that vibration plates are useful for lymphedema. And if you really, I think a good old-fashioned walk is just as good as going on a vibration plate, or going swimming, or just doing any kind of activity. But then if you try a vibration plate and you find that it works for you, then in your situation it may well be useful. But again, there's very little research at the moment. Hopefully that will improve. Do we have anything else on our list? What's our take on the plank debate for those with or at risk of lymphedema? Dynamic movement and contraction is clearly better, but is the plank or ski sit an absolute no? Oh, what do you think?
I mean, to me, nothing is a no. So it depends on everyone. So, and all these exercises will help with strength. So why not? But just you really need to know your body. If this is increasing your swelling, maybe you cannot do it so many minutes, or you do it kind of breaking it more. So you will need to actually tailor it to your needs. But yes, moving the limb, so the joint will help more the pumping, but then the plank will help the strength. So it's actually a combination of things that you need to actually incorporate. So for me, it's a yes, but be careful if your body actually tells you maybe it's too much, then you need to make some kind of adjustments.
And I think that's the same for any activity, any exercise. As we've said, start slowly, build it up. If you find that you're struggling in any way, then you may need to just scale back that activity rather than stop altogether. Or if not, there will be another activity that you can take up so don't be put off if you find that one activity you're finding difficult. Try and think of something else. I mean, there's lots of classes around. There's lots of, if you're maybe of an older age, there's lots of seated exercise classes in the communities and things like that. Just look for opportunities where you can maybe join in. There's a lot of evidence to say that group exercise is beneficial because you get the social aspect as well. So have a look in your local newspaper, on your local Facebook pages, and have a look at what may be in your area that maybe you can give a try. We've got a question about CrossFit and lifting weights. I think we've answered those.
Yeah,
not an absolute no to anything, really.
I would say for the question that if the limb's not yet heavy, what are the views on elevating arm or legs for part of exercise to work with and without growth? So if you don't have any heaviness, if you don't have any swelling, you don't have lymphedema, you do actually as normal. It's only when it's heavy or you have symptoms with a bit of pitting or a bit of swelling, or then it's when you actually need to pay more attention with gravity. But if your system is working fine, to normal life, yeah. And the progression markers for the load increase on the progression is, again, I mean, it's so individual that it needs to be worked out with your if you go to the gym, someone that they can tell you what you want to do, so how to actually do it progressively. They are the experts on the exercise that you want to do. So it's just actually taking it that you do it progressively. But to be honest, as a physiotherapist, I think everyone should actually do it progressively, because it's actually building up the strength in a better way, not actually hurting yourself, and how it needs to be done. I mean, generally, not only with lymphedema.
But if we're talking about restrictions, I mean, I've had patients in the past before that have gone back to horse riding, that have gone back to yachting. We know that there's dragon boat racing, that some patients join in, and there was some studies about the benefits of dragon boat racing and how it actually didn't increase patients' lymphedema. So I think we're right. Just give anything a try. If I had a patient that's had some surgery or has had some cancer treatment, I would certainly not say no to anything. I would say give it a try, build it up, see what happens. I mean, if you've got a great love of horse riding, for example, why would we restrict that? Why? That's your enjoyment. As I say, you may need to just not go out on your long treks that you normally did. Just build up to that. Do some work around the paddock, for example, until your arms and things have started to just get used to. But that's the same for after any kind of surgery. That not just cancer surgery, and it's not peculiar to lymphedema. So we would just advise you just to build up gently and do whatever you love to do. What else have we got? I think we've answered most of the questions, I think. I think there's a question about being able to get in get to a comfortable position, again, to do exercise or activity in the gym or so on. But I think, again, that's very specific. You have to be inventive, try and work around. And like we said, if you're going to a gym, their expertise, the instructor's expertise, they'll know a different way of doing an activity or a different way of using the equipment. So don't be shy, I think. Don't be shy. They're there to help you. So let me just check that we've answered all of your questions. If we haven't answered anything, if you find that you've got a question after this session that we haven't covered, you could always contact the British Lymphology Society or the Lymphoedema Support Network. They have a helpline and they have some real expertise there that would be able to help with any questions that you've got regarding any exercise and activity. The webinar will be available afterwards. And so anybody that's registered for the webinar will have a recording of it. And I think we'll just wrap up there because I think we have answered all of the questions. So thanks, Carla, for a great conversation about this important topic, and thanks to everyone for joining us and asking your questions. Our next lymphedema awareness webinar is on Wednesday, the 18th of March at 12 noon, when we will be welcoming Debbie Provan and Justine Whitaker, who will be giving us an insight into food and discussing how does what you eat and drink affect lymphedema and its treatment. So that's going to be a great webinar to join. And I'd just like to highlight our upcoming introduction to lymphedema study days. So for any non-specialists that have joined today, you might be interested in these new sessions that we've got. They're free sessions and they're introduction to lymphedema. And we have 2 study days, one at Bristol on Thursday, the 4th of June, and in Chester on Monday, the 5th of October. And these are designed to ensure that you're equipped with the knowledge and confidence to spot lymphedema early, provide supportive care, and collaborate effectively with specialists. And we'll pop a link in the chat. And if you'd like to register your interest for those study days, you'll be more than welcome. So I'd just like to thank Carla again for joining us today and helping me answer the questions. And we hope you've all enjoyed the webinar, and we hope to see you soon. Thanks very much. Bye now.
Bye bye. Thanks a lot.